Perfect. Yeah, I think we're live. Right. So thanks a lot, everyone, for joining in, and the ones who have registered for this to be recorded and sent as well. Uh, Quick introductions. My name is Akash Shah, and I lead the healthcare business for Lead Squared for the Americas market. And with me today is Jeannine, who is a mother, a fitness enthusiast, leads operations for Clearway, which is one of the most prominent players in the pain management space, serving more than what, 100 locations.
Oh,
Uh,
yeah. We're the largest in the country for pain management.
yeah. And I have known Jeannine for now close to a year. And two things I know about her, which I would want the audience to know beyond the introduction, is that she outgrows her role at a rapid pace. And, and her team just happens to love her. Uh, Or maybe it's the other way around, isn't it? The order was incorrect. Her team happens to love her, and she just outgrows her role at a rapid pace. So thanks for coming in, Jeannine. Before we really get down to the stuff around operations, just for the benefit of everyone, tell us a little bit about your journey. How did you get where you've gotten to from a 2-decade long career at IKEA and now leading operations in healthcare, which is a different field altogether. Tell us a little bit about it.
Sure. Well, first, thank you for having me. I'm super excited to talk with you and your team and everyone today. So I actually began my journey like 20 years ago. So I know
Mhm.
that's definitely aging me a bit. But I started in the retail space. So I started with IKEA US, just as a
Uh-huh.
front rep. So that was my first introduction to the call center industry. And I just fell in love with it. I was 18 years old. And it was just a job that I felt like was so different every day. I love just the hustle and bustle of being on a call center floor. And so I was
Mhm.
able to quickly just kind of work my way up from a call center rep and then working to be a senior rep and then finally went into management and held various management positions across IKEA throughout my tenure there. And then I also spent some time over at Prometric, which is a testing organization, and my area of the business actually assisted candidates who have disabilities. And so I oversaw the testing
Uh-huh.
accommodations department. So I think I take a lot of the values, not just from retail, but also my time spent with working with people with disabilities and really put that into what I'm doing here, now assisting patients who, a lot of them are in chronic pain every day. So I really do enjoy what,
Mm.
at the end of the day, I feel like I'm helping people.
Oh, that's amazing. Uh, so the question for you, with retail clinics or say outpatient clinics, right? Really popping up, growing massively, apps getting smarter than a doctor maybe, and I may be wrong, but at least at least they claim to be smarter than the doctors. And patients wanting, say, an Amazon level service. What does a great intake process even mean these days? Uh, I mean, what,
I think
share your thoughts around it.
Yeah, no, I think it's always changing, right? So I think the concept of what is good today
Mhm.
will continue to change as times evolve because people are always changing, which means their expectations are always changing. I mean, obviously, retail giants like Amazon have really changed the game. And so people do expect to get the same level of access that they can get, purchasing, whether it's a sofa or makeup or a t-shirt, with their
Mm.
health. So
And
again,
I
I
think
think that it's always changing, but for us, at Clearway, a good intake for my team is one that is seamless for the patient.
mm,
So, and that's regardless of what avenue they contact us. So whether they contact us through the phone or on our website or through, their PCP sending us a referral, I want it to be completely seamless for that patient.
in fact that brings me to another point, right?
Mhm.
And honestly, see, we've been working with a lot of physician practices, outpatient clinics, different kinds of provider setups. Uh, so what really happens, and try and be as honest as you can. what really happens when you really make patients wait? You mentioned seamlessness, but I mean, what we've been seeing is there are great setups who run operations really well, and then there are legacy setups or different setups which may not. I mean, there are, these huge wait times. I mean, do they plot their escape to the nearest urgent care, or just start, say, live tweeting their misery? What do they do?
Yeah, no, I think definitely right. If you make patients wait, whether they're waiting in your phone queue, whether they're waiting in the lobby at the clinic, or whether they're waiting for us to call them after we receive their referral, if you make them wait, that's telling the patient that, they're not a priority. They don't matter. And that is going to push them towards our competitors. And that's going to cost us their trust. And, once you lose trust,
Mm,
that's a really hard thing to recover from. Not even just from a patient perspective, even from our referral sources, right? Because we still have to
true.
make sure that they trust us and they continue to want to send their patients. So if you're not taking care of your patients in the right way, your referral sources, it is going to cost you just even a lot more than revenue. But that's why,
Mm,
for us, one of the things that we looked at was teaming up with you guys, what Lead Squared. And by being able to utilize that for our referral management system, we used to go sometimes, some of our markets would go days before they could actually respond to a referral. Now that we have Lead Squared and we've been
mm,
able to optimize our workflows, we make contact with every referral source with that patient within 24 business hours of getting that referral. And in some of our markets, like in our New Jersey and PA, we actually do it in an hour. So that though is
wow.
tools
That's amazing.
such as
Yeah.
Squared to really help us do that. Because again, once you lose that trust, it's really hard to recover from. So
In fact, I was talking to the CEO of I would say, a group of practices, and
yeah,
I said, "What do your patients want?" And I asked him, and he said, "To answer this very quickly, they want you to they want, what they want from you is text me, schedule me, talk to me right now. That's what they
yeah,
want, right? So while healthcare, everyone's trying to go at this lightning speed, and at the same time use a lot of technology, not make patients feel that they are talking to a robot. How do you keep your intake process moving quickly without making patients feel they are stuck on the bench just waiting for their shot to get in the game, right? I mean, so how does this balance with, like you mentioned, you've been using Lead Square, but how does this balance happen with a technology partner and operations, the balance of uh, tech and human touch?
so it is an art form. It's hard, right? It's definitely a hard balance. If everyone could do it well at Catch, then they would be doing what we're doing, and they're not.
Mm,
So,
I
you know,
know.
in all
Uh,
seriousness, it is a balance. So you do have to make sure that you have your digital tools are there, but you have to have that human element to go alongside with it. So one of the things that we enacted was just a quality assurance program.
mhm,
But what we do with ours is it's not just about making sure that they are checking off the boxes. That did we capture all the
mhm.
necessary information to create that patient chart? But we actually incorporate soft skills into what we are looking for and grading our staff members on. Again, dealing with pain management, when people are calling us, they are in a lot of physical and emotional distress, right? So if that patient says, I'm in a lot of pain, I expect our coworker to respond to that. Don't just ignore it and go into, what's your date of birth? You know,
Mm.
so
Yeah,
you have to be able to still be as fast as you can, but not making it feel so transactional.
true, true. Not make it transactional, and which invariably happens at a lot of places when the volume starts
Yeah.
piling up. Uh, and I think I keep talking to people, and try and give an example of you and how you've turned things around. Uh, Imagining the growth aspect, right at the start, and proactively making the base ready, I think this is something which a lot of people miss, and we've seen organizations be react. React to the sudden volume or the sudden surge that starts coming in.
Yeah.
Kudos to you for doing that. Uh, I had one more question around this. And we're still talking intake. So picture your intake reps. What are they doing that makes them, like the Beyonce of, say, patient access? Is there a secret talent, a magic script, a recipe you may not want to give out, but may have to give out today? So what is it?
I think one of the things that we really try to get across to our people is it seems very simple, but listening to understand, not listening to respond. So I think what sets apart our high performing team from others is we are very intentional, right? It's not just about booking that appointment. It's making sure that we
Hmm.
truly understand what that patient needs. Is it that for them, the next available appointment, regardless with the provider, regardless of the location, is that what's the most important? Or is it maybe someone where for them, it's more important to visit a clinic that's, located by their office? Because maybe they want to go, after hours, after they get off or on their lunch break, or, so again, really understanding how we can make sure that patients not only getting the right appointment, but it's that right appointment with the right provider at the right location and at the right time. So again, it's being just really intentional and understanding
Hmm.
patient needs. That's why I don't call them. I know,
And I think all of
like,
these,
yeah. So I was
sorry,
gonna say,
sorry, go
a
ahead.
lot
Sorry,
of
go ahead.
some other organizations may call the staff what we do, either intake specialists or new patient coordinator. For us, they're patient advocates, right? They're really there to, again, assist the patient,
Hmm.
understand, and get them on the right path to their care journey. So even something just as the way we acknowledge their role and responsibility and the way we communicate out, what they do, I think helps sets us apart and it makes them feel more connected to our mission here.
And I think when you talk about, when you give it this word called patient advocates, and I think we met at the healthcare call center conference, and I remember I had this one thought, I think which I would have conveyed it to you as well. Uh, the idea of not just running a call center, but owning patient access and patient care is the core of how your team becomes a patient advocate, right? And that's something you do really well.
Yeah.
But when you happen to have all these touch points converge, I'm assuming it's a lot of automation. Where can where can it swoop in to save the day, and where does it just make patients feel like they're stuck in a never-ending, say, a phone tree,
Yeah.
or a communication loop? What is good and what is bad, and where does automation really help?
So I love automation, obviously. Um, I like it because I think it helps free up space for, again, that human element part of what we do. So take, for instance, self-scheduling. As you know, it's something we recently just launched, and that is automated, right? The patient does not need to talk to anybody. They can get on their phone or their laptop at any time of day and schedule their appointment. But I think where I try to be really
Mhm.
intentional, again, about bringing that human side to it, is when I was drafting out the communication that they get once we've confirmed their appointment. If you just send them an appointment confirmation email that says, thank you for your appointment, it's booked, and you give them the details, that is robotic. So what we do and what I try to do with it,
Hmm.
making sure that, again, it reflects not only the Clearway brand, but our patient first philosophy. So it's not just the appointment details. It's we're honored to be part of your care journey. You've taken the first step, to living a better quality life. Just again, those wording that we're using, that's again bringing that human part to it. Anyone can send out a confirmation of the booking, but how do you bring it back to that patient? Understanding that for a lot of new patients too, again, in what we deal with in pain management, is some of them are nervous about taking that first step to getting help.
True.
And so I need to make sure that they trust us, and they know that we really do care about them. So it's so much more than just an appointment. And because again, right, booking the appointment's just step one. Our goal is to get them in the door, to get them with their provider and start building their care journey. So, and all the way we do that, whether it's through the phone, how my team is talking to the patient, or whether it is through the emails that come out after we booked an appointment or to remind them of their appointment. It is making sure that our wording and our language is, again, that patient first philosophy. So they feel comfortable and wanting to come to their appointment and get the help that they need.
Mm. So I think this works, and I'm assuming, and you can correct me here, this works really well with say the savvier ecosystem of the patients. Now
Mhm.
imagine, or let's pretend like I'm your Aunt Linda, or
Yeah, I
or
know.
I was just reading, this huge shift where a lot of folks in the United States are now going to be 60 years and plus. Uh,
Mhm.
and I'm assuming they may not be as savvy as, say, a millennial, right? Walk us through exactly how a new patient goes from, hey, I think I need a checkup, to seeing a provider via your call center. How does this work, and for different groups?
So with us, right, the patient journey can come in a couple different ways. So it can, of course, be a phone call. It can be somebody that, Googled, found us on Google, or maybe they've seen some of our social media ads, and are reaching out. It could be that they went to go see their PCP or their chiro, and they've been referred out to us. So the journey and the path can look a little differently for the patients. But one of the things that we try to do is, again, regardless of the channel they're coming through, is that their patient experience is consistent and they're getting the same. And I think that also goes back to us just being really intentional with the way that we communicate with the patients on the phone, and listening, again, to understand. Is it someone that we do need to maybe use more plain, simple language? Or is it someone that, they kind of already know the system and they're just trying to get on to the next one? So, taking each call for what it is,
Mhm.
not so much worried about checking a box, to hit their QA. It really is about that patient experience, with them. Um, and I think when you're looking at the way we handle referrals, again, bringing Link Squared back into it, we have also built out our referral management with you guys to where we send out a lot of automation that goes back out to the referral sources to keep them in constant communication with, giving them that feedback of where that patient is at in their journey with us and trying to contact them. That's also made a really big difference in how we communicate, and just building those relationships again with those referral sources, and just being transparent. If we're unable to schedule, if we're unable to make contact with the patient, again, just having those, I think, open lines of communication with the referral sources also does assist as well.
So I think for everyone who's listening in, it's a very well planned, well thought out, a well oiled mechanism or a process set. It's not a secret hotline that only VIPs know about, and you get
Yeah.
to the get to the provider. I don't think that works. Uh, we all keep talking about patient experience, improving the patient experience, but what what's actually different on the front lines? I mean, from the say 5 years back, from the time 5 years back, or even say 2 years back, does that mean lesser paperwork? Does that mean I don't have to go in and do the same thing again during my appointment? What does that mean for a patient today?
So one of the things that we're always doing is looking at, what are we doing today that we can do better tomorrow? So let's say 5 years ago, a lot of the papers and the forms that patients need to sign for their appointment, you would have to show up to your appointment 40 minutes before your new patient appointment to fill out that paperwork. No one has time for that, right? We're not doing that in this day and age. So again, we've used more digital tools like Freesha to be able to send out all the information they need to do so they can do it before they get to their appointment. And now new patients can arrive, 15 to 20 minutes before
Hmm.
the I think those things matter, make a difference. Again, we're trying to be simple and easy, do what makes sense, utilize the tools that we now have today that we didn't before. Again, lead squared. Going back to referral management. Before we would get the referral in and my team would have to send out manual emails through Outlook. I hate working at Outlook. So it was
Hmm.
so time consuming, so inefficient. Now with Lead Squared, we have built, again, those automation emails that go out to the referral source. So we're able to keep them in contact. So that experience happens, again, so much more efficient and much faster than it did before. Um, Again, going back to the phone calls, we always are looking at, especially for those new patient calls, because they're the longest calls that we have. And we have to gather a lot of information, but always trying to look at, let's make sure we're gathering the information that we need. Are there things that maybe the front desk can gather that we don't need to keep them on the phone? No one wants to spend 20 minutes doing, making an appointment. No one wants to do that. So
True.
we really try to keep it to around that 7-minute mark to gather all that information. But again, I think it always just goes back to looking at what are you doing today that you can do better tomorrow? Because there's always room for improvement. We're never going to be perfect, and we need to constantly adapt and pivot to meet the needs of our patients.
It's interestingly, I was talking to one of the largest or one of the larger health systems yesterday, and uh, their operations team was telling me that, the patients do come in and they do have a digital journey, they have a digital intake, uh, and they can even schedule with, say, the doctors or the intake staff, both ways. But when they come in for the appointment, they have to go through the process again. And my question to them was why, and if then what's the digital leg about? So the answer to that question largely was residing in a lot of their systems are not integrated. So while they have something for their patient-facing journey, and they have something for their providers, but these two systems do not talk to each other. How important is integration? And I know it's important, but how important is integration? How important is consolidating multiple systems as much as possible into one? And or what do you see as, the value coming out of it?
Yeah, first I would say, why would they have done that? Like before you're going to introduce a new tool, right? You want to make sure that it's integrated. You have to look at the whole process, from beginning to end. Um, and that I think is also a part of making sure your organization doesn't work in silos, right? Everyone needs to communicate, make sure you fully understand that experience, but you have to be able to integrate um, at the best you can. One of the reasons why I love Lead Squared is the way you guys are able to integrate with Athena and with our appointments. A lot of other platforms can only integrate capturing the appointment. You guys were able to not only secure the appointment, but run the insurance, which is huge. And not a lot of platforms can or were willing to do that. Because if you guys didn't run the insurance, then that means I have to have someone manually work all those appointments. And then it kind of, then what's the point of having the integration if I still need someone to manually do it? So, no, I think integration is huge. I'm actually really looking forward to doing more cross-platform integration between not even just Lead Square, but the other tools that we use, like Dialpad. How can
Mhm.
we integrate all those together to make a more customized and personalized experience? But you
Hmm.
have to understand the whole flow. You can't only understand part of it and then end up putting more work on your team, or on the patient. So
Hmm.
before you introduce anything, make sure you understand how it all fits together. And you
And
can
I keep
fit together 100% perfectly, because not everything's going to be perfect. But if you're making progress is more
Mhm.
important than perfection.
Talking about progress, and I'm sure you know about this. Uh, we hear a lot of AI and AI stories and the need and the race to adopt AI. Uh, and at the same, the other side of the same coin is, and I keep saying this, we see setups not do the basics and run, in the race for AI. AI is great, but you need to have your house in order, right? Where do you think, what are table stakes to run, and a successful intake operations team? Uh, and where does the shift to AI really begin? Because it may be just a buzzword for a lot of
Yeah,
folks. It may be, uh, it may not be something like, not being able to completely understand the impact of AI, and
yeah,
at the same time not be aware of your own operations. So
yeah.
where do you see this getting played out?
So we first started utilizing AI when we integrated with T-Mobile and Dialpad in our telephony system. So for us, we're still less than a year into it, but it's more on the staff. So it's not so much for the patients to see AI, but it's for us. So um, and when we're taking phone calls, the AI is listening. So we've built it to listen for certain words and keywords to then, essentially alert my staff member with whether it may be a reminder on a specific appointment type or any little nuance that we might want to be proactive,
Mhm.
but we can make sure that we're scheduling the patient again the right way the first time. So we've used that as a tool. It's also really helped me when I'm looking for, say, a call for feedback. As I'm sure many other leaders and contact centers know, you will get feedback from various stakeholders saying, a patient was said that the call center told them this, or and so what I love about it is before you were only limited to trying to find that call by the phone number that the patient called in from. But now with AI, I can search for keywords. So it
True.
makes that process a lot easier too for us. So
Mm.
again, we're still fairly new on our AI journey, but we're using it more for like staff development as opposed to patient facing. But I think with any tool, whether it's AI or any other, next advancement that's going to come, at the end of the day, your tools are only as good as the people behind it.
True.
So even the way we use it, again, we had to build it to listen to those words or to understand, because it also does like transcripts. So maybe the way the AI hears our provider's name or something, I have to build it out with the spelling of how AI thinks it is. So again, it's only as good as the people that are behind it. So
Mm.
I think that there's advantages to it, but you still have to put work into it. It's not going to magically fix and solve everything for you. That's for
True.
sure.
True. True. Uh, what is it? I mean, I know you came in and you made a lot of changes at Clearway, and you always talk about incremental progress, right? One step at a time. Uh, what's this? What's the one oddly specific change, or say we can talk about more changes. I mean,
Yeah.
completely. I mean, all years. But what are these changes that you made? And this is more from a learning perspective, because there would be more folks listening into this webinar, a bunch of folks who would get a recording as well. But what are these changes or the challenges that you identified? And you said, these are my quick wins. These are some transformational wins. Uh, and also tell us if any of these got discovered as an accident.
Ooh, okay. So, of course, some of the major changes are going to be the technology, which would be Lead Squared, as well as, T-Mobile without that. But I have to also say that I think a lot of the small changes people can do don't require big technology investments, right?
Mhm.
So one of I think the most underrated things in contact centers is the IVR. Like I think people kind of look over that or they don't think it's as important as it really is, but that a lot of times is the very first experience patients have with your brand is your IVR. So when I came in to Clearway, I knew right away after listening to it and doing some test calls, like, oh, we can make this better, right? There's too many options. Um, so that's number one is you have to make sure your IVR is simple.
Mhm.
That does it sound, uplifting when they call it, you don't want to again sound like a robot. And are you making sure that when the patients are selecting their options, they're getting to the person that can help them? You don't want all these unnecessary transfers. So make sure your routing is done right. limit the amount of options. You do not need to have 10. Nobody's listening to that. Again, it's got to be simple. So that was one of the first things I did. Pretty, easy win there, just redoing the IVR and the routing. Also, again, then looking at your skills and all those different cues, doing more of a skill-based routing. For us, we always prioritize the new patient queue, of course. So that's the one that our agents will get before they get any of the call type. So I think understanding all of that, but you can even go more simple. If you are a leader in a contact center today, and maybe your organization does not have, $1 million to spend on a technology investment, you can also really just look at how you are organizing your staff, like your staffing model. Do you make all their schedules aligned, with your call volume and with those intervals? Is that how you're doing your breaks? Are you ensuring that your coworkers are adhering to their breaks? There's a lot of little things that I think contact center leaders can do that will have big results that again don't require a lot of investment. But the big investments for us that have paid off, of course, Lead Squared being one of them has really just been a game changer for us. So,
which is exactly what my next question is. What's your intakes team's go-to tech? What tools are so clutch that you'd panic if the Wi-Fi went out? I mean, so
yeah, yeah, right. It's Lead Squared for us. I mean, well, a combination of T-Mobile dial pad, because of course, if calls can't come in, that's going to be not a good thing. But what Lead Squared really helped us, and again, really changed the game for us. So for a lot of our regions, they were not managing their referrals. They didn't even track them. So, how can you manage something that you don't measure? So step one is we have to get the team at least manually tracking them, putting it on a spreadsheet, making sure that we are making multiple attempts to these patients. As you know, here at Clearway, we do a 5-day engagement process where every referral, we're going to make contact with that patient every day for 5 business days. And it's a combination of both phone calls and text messaging. And then again, Lead Squared allowed us for the automation with the emails back to the referral source. It allowed us to optimize our workflows so I can clearly see, how much work do we have coming in? How many referrals are coming in? How many are we processing? If we're not able to convert them, why are we not converting them? So it does just give us so much more data for us to help, again, drive our business forward. So Lead Squared for us has just been a game changer in the way we work. And that's why we're able to convert, as many appointments as we do. And we weren't able to do that without a tool like Lead Squared.
And I'm glad we've been of value. I have a slightly tricky question now, and you can choose to answer or dodge.
Okay.
We all learn from our mistakes, and for the benefit of the larger audience, it's not always hunky dory, right? When you run an intake or an operations team, tell us about. I mean, one such incident when the intake went totally wrong, and what were your learnings from it?
I don't know one specifically
Mm-hmm.
comes to mind, but I can just say, like in general, again, I spent a lot of my career at IKEA. And so for anyone that knows IKEA, Ingvar Kamprad was the owner. And so he had philosophies that he shared. And one of the favorite ones that has always stuck with me to today is, dare to make mistakes, always for a good reason. And again, that's just something that I've taken with me just throughout my career. And that's what I allow to my team. It's always okay to take a risk and to take a mistake as long as we learn from it. And with any new initiative we're doing, whether I'm launching Lead Squared or we also launched some new Frisia services. If it doesn't work, we can always go back, right? Like we're not married to any one solution. So let's try. I think you have to try, first take those risks. And a lot of times they're going to pay off well. So hence Lead Squared obviously worked for us very well. But even switching from telephony systems, we used to be on Ring Central, we switched to T-Mobile dial pad. And, while that gave us a lot of new features that I really love, there's always, some learnings that come along with switching to major platforms like that. But yeah, you have to be able to try and move forward, and everyone's going to make a mistake. Another thing that Ingvar always said was, only while sleeping does one make no mistakes. Don't be scared to make that mistake. You can always recover. There's nothing, I tell my team that all the time, there's nothing that you've done that like we can't come back from. And there's no such thing as, a bad idea. Another thing I'm doing right now with my team is we are relooking at how we brand and work with some of our legal partners. And so I reached out to the coworkers that work those referrals, right? Because they're the ones that are closest to the process and say me, or even marketing for that matter. So I went to them directly, to get their ideas. Look at this
Mhm.
web. Tell me from a patient perspective and from an attorney perspective, is it easy to understand? Does it make you want to, refer your patients to us? Like I told my team, like, don't be scared to share your ideas. And I purposely had it in a situation where I had my peers with me. So I'm now asking, my team to share their thoughts and ideas with upper management. And, for a lot of coworkers, that can be a little scary, or you're scared you're going to say something that, might come off not the right way. But I really try to encourage my team. Hey, you're a part of all of our decision making, no matter what level. I don't care about levels. I'm not a title person. And so I want that, to really resonate with them. And while I can't maybe enact all their ideas, right? I can't maybe do every single one, but I love hearing them. And I'll see, how can we make the patient experience better with their specific feedback? Because they're the closest ones to it. So yeah,
No,
don't be scared to make a mistake.
yeah, in fact, that's true. There's no such thing as a bad workout and a bad idea. The only
Yeah.
bad workout and a bad idea is the one that never happened. So,
Yeah.
yeah.
Yes. No, I love that. So true. And that's what I try to tell my team. I think that's the only way we grow. I
True.
love getting everyone's different perspective on things. So I think I bring a different, perspective because I have retail as the source of my background.
Hmm.
But I have other team members that are on my team that only their experience is from healthcare. I have some that, again, came from the testing industry. Like, again, I think everyone can bring their unique experiences, whether it's through their education or their previous jobs, and then what they're doing today for Clearway, and bringing that all together. And then that's how we all get better. It's our
Hmm.
collective, experiences that make us strong. And that's why we, perform the way we do. I'm just gonna say it. I have a really good team. So they're
Yeah.
they're killing it. So we do good. We do good work.
I think talking about ideas and innovation, if you had to take a punt at it, take a shot at it, what innovation would just shock everyone by actually working? I'm not saying by not working, by actually working. It's so not likely to work that it would just shock everyone. Or what change would shock everyone? I mean, what is that one thing which a lot of us in healthcare have accepted as a norm? And
Mhm.
if that changes, it would be a little shocking than surprising. And you can decide
Yeah,
to take a shot at it or just leave it. But I'm just
I think it's
curious.
just more self-service tools, right? I think when I even first got here with self-scheduling. So I guess the organization had done like a soft launch of it a couple of years ago, and it just never took off.
Hmm.
People were really scared to what they would consider like open the floodgates, like, oh no,
Yeah,
people can't schedule without a person. And again, making sure they understood how it works, right? It's all tied back to your scheduling template. We can't do anything outside that scheduling template. So again, working with them to understand it, and then also making sure that their template was, as good as it can be.
yeah. Hmm.
Um, and then we launched it, and to be quite honest, you had some providers that were very scared and didn't want to be on it and would ask me to not be a part of it, and I had to respectfully decline. We are moving forward, and of course, again, making sure that they understand how it works so they weren't so fearful of it. It's the same template that we schedule off of when they call in. This just takes out that person. And another reason why I love self-scheduling, and especially again in pain management, is I think a lot of times when people are in pain, especially for these new patients, it's scary, right? To have to put yourself out there and to, try to get help. So when that patient reaches that point where they're like, enough is enough, like I need some help. And
Hmm.
sometimes that could happen, say 10 o'clock at night when they're lying in bed. I don't want to lose that, by having them have to wait till 8 a.m. the next day to talk to someone to call and get an appointment. I wanted the self-scheduling so they can do it right then and there from their phone, book that appointment. Um, and so that's why I really pushed it with my organization is that we have to be accessible and again, meet the patients where and when they want to be met because it's, we're impacting their life. So we need to make sure that we can get them, especially once they've made that decision that they're ready to take this next step. I want to make sure I grab it at that moment. So I don't want to have them wait and only be available to schedule Monday through Friday, 8 to 5. Because
Yeah,
care does not, only happen Monday through Friday, 8 to 5, So why
yeah.
should schedule them? So that was a big one that we launched and is that it's been received very well now from our patients. So
I think, and I completely, agree with you on self-scheduling because this is one place where we've also found a lot of challenge because there is a real challenge. And then there is a human at the other end, which not necessarily wants to be so transparent, for the lack of a better word. But what we've done is, in fact, we've tried to solve for it in a way, and we've been getting, again, a decent feedback. What we thought of was, why just self-scheduling?
mhm.
Imagine a patient coming in and filling up a form and getting a plain simple thank you for contacting us
Yeah,
message. How do we change that experience? Because it's just not self-scheduling. At least that's what we thought. uh, we said, let's transform that experience to be, I fill up the form and then I get redirected to a personalized microsite, which we are calling comfort site. It's comforting for me to know
yeah,
more about the provider, where you can put in testimonials, videos, and a
yeah,
small section where you allow them to drop you a text, reach a chatbot, schedule an appointment. It's more of an interactive, what you're calling comfort side. And that's been gathering a lot of steam. So completely aligned with what you're saying.
yeah.
Uh, I think this has been good, Jeannine. I think we have a couple of questions, and I'm not sure if I can make sense of all of these. So let's see. We are the agency that manages the digital user experience on behalf of a large healthcare provider. Our biggest challenge is having exposure to full PX and patient journey. And that's the question. I mean, that's not the question, that's the challenge. I don't know how to react to it, but if you have any reactions to it.
Yeah, well, I think that's something, right, that Lead Squared actually has been working with our marketing team on to really, capture that full patient journey. So that does require, a lot of like what we talked about earlier, the integration with the cross integration with the platforms. So I know that is something that we are looking at as well. Um, I think there's different ways you can back into the same data. Like you could definitely, you know, pull if you want to see like on your website how many patients actually, were on the website and then from there book an appointment. So you can get the data from the website and if it's got the phone number, then you can back it into the patient profile. There's ways you probably can do it, but if you want something more seamless, then it's going to require a platform, some type of technology advancement. Which again, I know Lead Squared is working with our marketing team on. So there are solutions out there, for that. But those type of integrations, again, is what's going to help us in the long term really have more personalization with these patients. And that's where you do need technology. So technology is going to come in. So whether
Right.
that's different campaigns on their particular, type of appointment or type of pain that they were going through, how can we target um, certain patients with certain information. That's technology. So
Right. And I think before we let you go, Janine, it makes all the sense to, get the ones who are listening into us a little bit of a learning from you or advice from you, I must say. what would you advise to someone who's getting into a leadership operations role, someone who's been there for a decade? I mean, two different personas.
Yeah.
What would your advice be?
So for me, the way I lead has always been people first. So again, I started my journey as that frontline coworker answering phone calls. So I think always remembering what that was like, and remembering what you needed in a leader and what you wanted from, and that's really at any level. I think if you can identify what makes a good leader to you, what you're looking for, then you can enact that to your people. Because like we've been saying through this whole conversation today, digital tools are great, but it is the people behind them that really matter. And so if
And
you
that's
do
what
right by your people, I promise you, they will do right by you. And if you believe in them, they will go much further than you probably ever thought possible. Sometimes people just need to know that their manager has their back, that they trust in them, and that they see that they are bringing value to the team. And they will go way, way more than you ever could have imagined. So always
and I think
feel people at the heart of everything you do.
I think we've come a full circle from where we started this conversation, where I said Jannine's team just loves Jeannine, and here you are saying people first. So
Cool.
everything aligns well. Thank you so much for doing this, Jeannine. This was a great conversation, and Godspeed to you. You're the best.
Yeah, thank you. I had a lot of fun. Thank you.
See you. Take care.
Bye, guys.